In this video, I'm going to share with you one fact about alcohol that doctors don't tell you. I've worked in hospitals, clinics, and private practice, and after all this time working with people, I've never heard a doctor tell their patient this one fact about alcohol, and it's really important for you to know because it might save your life. So let's talk about what I'm talking about. The one thing that doctors don't tell you about alcohol is that it can cause cancer. Now, I'm not here to shame anyone for drinking alcohol. It's your choice and it's your life. And I know that for many of us, we use alcohol to cope with stress, to help us relax, to help us fall asleep, or even just to celebrate our wins in life. But what you need to know is that it comes with some serious side effects, especially if you are having more than 2 drinks every day. So, here's the thing. You see, when you drink alcohol, whether it's wine, beer, or liquor, it doesn't matter. It goes through your liver, and it breaks down into something called acetaldehyde. That means that it has the ability to change the DNA of your cells and make them become cancerous. The liver then converts that acetaldehyde into acetate, which is much less harmful to your body and can actually be used by your body for energy. Now, most adults can metabolize or break down alcohol faster than it is being absorbed from their stomach into their bloodstream. But once the amount of alcohol starts increasing, like when you're having more than 2 drinks per day, the liver cannot keep up with breaking down that alcohol fast enough. And as a result, the acetaldehyde starts building up in your body, and that's where the damage begins. You see, when that acetaldehyde builds up in your body, it starts attacking different organs. If it's in your breast tissue, it can cause breast cancer. If it's in your colon, it can cause colon cancer. If it's in your liver, it can cause liver cancer. And if it's in your mouth, it can actually increase the risk of developing cancers in your mouth, on your tongue, as well as cancers of the throat and the voice box. It gets worse. When the acetaldehyde builds up in your body, it also weakens your immune system. This makes it harder for your body to fight off viruses, including human papillomavirus, or H, which can lead to cancers in the anus, the cervix, the vulva, and the vagina. I want you to know that I'm not trying to scare you with this information. I am just trying to educate you so that you have all the facts and then you can make your own decision on how much alcohol you want to drink. You can choose to stop drinking altogether, or you can choose to continue drinking, but at least be aware of the risks involved so that you can take steps to protect yourself against these cancers. For example, you may want to consider getting screened for certain types of cancer earlier or more often if you're choosing to drink more than 2 alcoholic drinks every single day. And I also want you to know that this recommendation of no more than 2 drinks a day applies to both men and women. If you're a man who's over 65 years of age, you may be thinking, hey, I've already had my time. I've already lived past the age where I was supposed to die, so why should I worry about drinking myself to death? Or maybe you're a woman who thinks, oh, the 2-drink rule, that doesn't apply to me. SIU, girls who want to look pretty and stay thin. Well, guess what? It actually does apply to you. And here's why. As a person gets older, they lose muscle mass and they gain body fat. Because of this, alcohol gets distributed differently in an older person's body. It stays in their bloodstream longer and it reaches the brain faster. In other words, the way that alcohol affects your body changes as you age. Here's another interesting fact that doctors don't usually tell patients. Drinking alcohol along with certain medications can be very dangerous. For example, did you know that mixing alcohol with either of these 5 medications can kill you? Yes. If you take any of these 5 medications and you mix them with alcohol, it can actually put you into a coma or kill you. The first one is any medication that has the word all in it, such as alprazolam, which is Xanax. The second one is any These are medications like Valium, Klonopin, Ativan, any of those end in AM or on. The third one is any opioid pain medication, such as morphine, oxycodone, hydrocodone, any of those medications. The fourth one is any sleeping pill. These are medications like Ambien, Lunesta Sonata, any of those drugs. And lastly, it's any diabetes medication that ends in glinid, such as glyburide or And it gets even more complicated than that, because there are many other medications that you should not mix with alcohol. Mixing these medications with alcohol can cause dangerous side effects like low blood pressure, drowsiness, dizziness, and impaired coordination. Examples of these medications include high blood pressure medications, antibiotics, antidepressants, and blood thinners. And here's one last thing that you need to know. Even though I've given you a lot of scary facts about drinking alcohol, the good news is that if you stop drinking, your body can heal itself. Your body has an amazing ability to repair itself. And within just 24 hours of stopping drinking, your blood pressure will go down, your heart rate will go down, and your body will start producing new healthy cells. After 3 months of not drinking, your liver starts to heal. After 6 months, your body will excrete 90% of all the alcohol you were drinking. And after 1 year, your chances of getting drunk will decrease by 50%. Look, I know that many of you watch my videos because you're struggling with quitting drinking. So I want to send you a message of hope. It's possible to quit drinking and live a happy and healthy life. I know it's hard, but it's worth it. And I believe in you. If you found this video helpful, please click the like button below. It helps my channel tremendously. And while you're at it, subscribe so you can get more awesome health tips like this one. And hey, if you're still doubting whether or not you should stop drinking, check out this video right here where I talk about 10 reasons why you should quit drinking altogether. I'll see you next time. Today's topic is one fact about alcohol that doctors don't tell you, and I think it's important for you to know. So, in this video, I will be sharing one fact about alcohol that can help you make a better decision regarding your alcohol consumption. And this fact is supported by multiple studies. So, let's dive right in. No. One fact that doctors do need usually tell patients about alcohol is that drinking alcohol can actually improve your health. And I know this may sound contradicting because we know that too much alcohol consumption is bad for us. But research has shown that drinking alcohol in moderation can actually benefit our health. Now, you might ask, how much alcohol is considered a safe amount? Well, according to the dietary guidelines for Americans, moderate drinking is defined as up to 1 drink per day for women. However, keep in mind that it's important to note that if you choose to drink, it's crucial to do so in a responsible manner and to be aware of your own limits. Some people may feel the effects of alcohol more strongly than others, and some individuals should avoid alcohol altogether due to specific health conditions or medications they're taking. So, how does alcohol provide health benefits? There are several potential mechanisms through which alcohol may offer health benefits when consumed in moderation. One is that alcohol can increase levels of HDL cholesterol, which is known as good cholesterol. HDL cholesterol helps remove harmful types of cholesterol from cells, reducing the risk of heart disease. A study published in the American Journal of Clinical Nutrition found that moderate alcohol consumption was associated with higher levels of HDL cholesterol in both men and women. Another study published in the journal PLOS Medicine discovered that moderate drinkers had lower rates of cardiovascular disease and cancer compared to non. The researchers suggested that alcohol's impact on HDL cholesterol could be one of the reasons behind these findings. Another potential mechanism by which alcohol may provide health benefits is through its antioxidant properties. Alcohol contains antioxidants, such as polyphenols, which can help protect cells from damage caused by free radicals, which are unstable molecules that contribute to aging and disease. A study published in the journal Alcohol and Health found that moderate alcohol consumers had lower levels of oxidative stress markers in their blood, suggesting that alcohol's antioxidant properties may play a role in reducing the risk of chronic diseases, such as heart disease and cancer. Important to note that while these studies suggest that there may be some health benefits to consuming alcohol, the overall consensus among health organizations that the risks of excessive alcohol consumption outweigh any potential benefits. For example, the World Health Organization estimates that nearly 3 million people die each year as a result of alcohol-related issues, which is equivalent to almost 8,000 deaths every day. Excessive alcohol consumption can lead to various health problems, including liver disease, heart disease, pancreatitis, and certain types of cancer. It can also have negative social and economic consequences. In addition, the research on the potential health benefits of alcohol is not conclusive, and further studies are needed to fully understand the complex relationship between alcohol consumption and health. Number 2. Doctors often fail to discuss the potential benefits of moderate alcohol consumption with their patients because they are primarily focused on preventing the harmful effects of excessive alcohol use. Many healthcare professionals receive limited training in addiction medicine during their medical education, and they may feel uncomfortable discussing alcohol consumption with their patients. This is despite evidence that shows that brief interventions by doctors can effectively reduce alcohol consumption in patients who drink heavily. According to a study published in the New England Journal of Medicine, when primary care doctors provided brief motivational interventions to high-risk patients who were drinking heavily, it led to a 29% reduction in self-reported heavy drinking and a 37% decrease in alcohol-related problems over 6 months. Another reason why doctors may not bring up the topic of moderate alcohol consumption with their patients is the fear of being perceived as condoning or encouraging alcohol use. However, research has shown that patients may actually appreciate their doctors discussing the potential benefits of alcohol in addition to the risks. A study published in the Journal of General Internal Medicine found that patients were interested in learning about the potential benefits of moderate alcohol consumption when discussing alcohol use with their doctors. Additionally, patients were more likely to perceive their doctors as non-judgmental and empathetic when the doctors discussed both the benefits and risks of alcohol consumption. If you are interested in learning more about the benefits of moderate alcohol consumption, I encourage you to talk to your doctor. Your doctor may be able to provide you with more information tailored to your specific situation. However, please remember that it is ultimately up to you to decide whether or not to drink alcohol based on your personal beliefs, values, and health status. No? 3. Another fact that doctors do not tell you about alcohol is that drinking alcohol can potentially help reduce the risk of dementia and Alzheimer's disease. Now, before anyone starts thinking about drinking alcohol for this purpose, please note that the evidence is not conclusive, and further research is needed to fully understand the relationship between alcohol consumption and cognitive decline. Also, the potential benefits of alcohol on dementia only apply to individuals who do not have a history of alcohol use disorder and only in small amounts. Excessive alcohol consumption can actually increase the risk of cognitive impairment. A study published in the journal Neurology found that moderate wine drinkers had a lower risk of developing Alzheimer's disease and other forms of dementia. The researchers suggested that the beneficial effect of wine may be due to its resveratrol, which has been shown to have neuroprotective properties. Another study published in the journal BMJ in 2018 found that moderate drinkers had a lower risk of developing dementia, but only for those who started drinking after the age of 50. However, it is important to note that the study did not establish a causal relationship between moderate drinking and a reduced risk of dementia. Instead, it revealed an association between the two. Other factors could be at play, and more research is necessary to determine whether alcohol consumption actually causes the observed association. Overall, while there may be some potential health benefits to consuming alcohol, it's essential to consider both the risks and benefits before making a decision about alcohol consumption. Excessive alcohol intake can have severe health consequences, and individuals should always prioritize their health and well-being when making decisions about alcohol use. Additionally, the research on the potential benefits of alcohol is not conclusive, and further studies are needed to fully understand the complex relationship between alcohol consumption and health. I hope you found this information helpful. If you enjoyed this video, please give it a thumbs up and share it with your friends. And if you want to learn more about alcohol and its effects on your body, check out this playlist here. Thanks for watching and stay healthy.